So here we're going to talk about infections of the blood, and we're going to focus on parasites. So there are several important parasitic infections of the blood for humans. Malaria is probably high on the list when people think about parasitic infections, but there's also trypanosomes and filariasis. So malaria is going to be a disease that is going to depend on which type of malaria you're exposed to. And you're going to typically have a clinical presentation that's going to look like a flu type infection. However, you also will have vomiting and diarrhea, which is not flu-like. Your progression can be very fast. And so a lot of it depends on what area you're in. So if you're in an endemic region and a visitor to these endemic regions, you can get exposed to malaria. Malaria can have severe symptoms. A cerebral malaria, renal failure can occur, and acute respiratory distress syndrome also. You can have a splenomegaly, and the spleen could rupture, but that's very rare. Now, malaria is going to be diagnosed with the gold standard, which is this ring phase, or a trophozoite or schizont in those phases. You can also use indirect antibody fluorescence to mark the actual parasite. Now, another disease is Chagas disease or trypanosomiasis. This is the American form of trypanosomiasis caused by Trypanosoma cruzi. This has the Romana sign, which is a swelling of the eyelid. Acute Chagas disease, basically, it's going to be transmitted through a bug feces, and typically children will rub their eyes and introduce the bug feces into the eye that has the actual parasite. Now, the symptoms are going to occur right after infection, so it's a very acute presentation. You're going to have fever, swelling at the site of the bite, such as the eyes, the eyelid, and a parasite in the blood. This is going to be chronic and indeterminate, so you can't detect the parasites. You're going to be basically infected with life for your life, and you're not going to have, and about 20 to 30% will develop debilitating, life-threatening illnesses, and everyone else who gets infected will have no other symptoms. A chronic phase, you can have sudden death, which is associated with heart rhythm abnormalities, dilated heart. You can have difficulty eating, and AIDS patients can have reactivation of the parasite in blood. Now, Chagas disease is, again, you can detect the parasite shown here in a blood smear if it's acute phase. Chronic phase is the symptoms, and if you are potentially exposed to it, as well as serology. Treatment is going to be aggressive if you have an AIDS patient, and the CDC has anti-parasitic treatments for this. Filariasis is going to be caused by Bancroft or Triera Bancroft, and this is going to be transmitted by your mosquitoes. These are thread-like filarial nematodes or roundworms, and these are going to live in your lymph system. So remember, you have your blood system, and you have a separate circulatory system, which is your lymphatics. In the world, this is a leading cause of disability. It's very rare in the Western world. This is going to lead to elephantitis, and sometimes you have such severe scarring and tissue changes, it's going to be irreversible. The control of the vector is what's going to help to control the infection. So filariasis is going to be mostly asymptomatic. You're going to have a lymphedema, which is you're basically, in this case, you're getting swollen lower extremities, but it's not the blood that's causing this. This is in the lymphatics. This edema is going to allow it to infect the skin and lymph, and it's going to increase the bacteria, normal flora type bacteria. And then this is going to cause elephantitis, the hardening of the skin. You can also have swelling of the scrotum in men. So this is another example of elephantitis. Diagnosis is going to be those microflaria in the blood smear at night, so it's nocturnal periodicity. And you're going to have eosinophilia. This is a parasitic infection, so that leads to a Th2 response, which is going to be IgE. And you're going to get your mast cells and your eosinophils. The treatment can be carbamazine, which is going to kill that microflaria as well as the adult worms.